So hello, welcome to another. So specifically today we are going to concentrate on the structure and function of the lymphatic system. So this is how the lymphatic system actually looks like. So we'll go through the structure, even the function. So we're going to cover the lymphatic system, the lymph nodes, the lymph vessels, and the structure of the lymph. Okay. So the body cells are actually bathed in interstitial, which is the tissue fluid, which leaks constantly out of the bloodstream through the permeable walls of blood capillaries. Okay, then some tissue fluid actually diffuses through the more permeable walls of the lymph capillaries, forming lymph. Then lymph passes through the vessels of the increasing size and a varying number of lymph nodes before returning to the. Okay, then this lymphatic system actually consists of lymph. We have lymph vessels, we have lymph nodes, we have lymph organs such as the spleen and the thymus, and of course there's a diffuse lymphoid tissue, for instance the tonsils, and of course even the bone marrow is also one of the structures. Okay, so this is what we are talking about. So the red bone marrow, okay, the spleen, that's what we are talking about. These are the structures we are talking about. Okay. Let's start with some of the functions of the lymphatic system. The number one function is tissue drainage. So about 3 to 4 liters of fluid is actually drained away by the lymphatic vessels. The second is absorption in the small intestines. So there is fat and fat soluble materials. For instance, the fat soluble vitamins are absorbed into the central laterals, which is the lymphatic vessels of the villi. Then the other function would be immunity. So the lymphatic organs helps in the production and maturation of lymphocytes, the white blood cells, and also these are also responsible for immunity. Then the bone marrow is considered to be lymphatic tissue since lymphocytes are produced there. So that's why we also consider the bone marrow as well. Okay. So now let's start with the structures such as the lymph and the lymph vessels. So the lymph is a clear watery fluid, and the lymph actually transports plasma proteins that seep out of the capillary beds back to the bloodstream. It also carries away large particles, for instance, bacteria and cell debris from damaged tissues, which can then be filtered out of the destroyed, we can be filtered out and destroyed by the lymph nodes. And lymph actually contains lymphocytes, which are the defense cells. Then in the lacteus of the small intestine, fats absorbed into the lymphatics give the lymph, which is a fluid which we call chyle, which has a milky appearance. So chyle is one of the uh, lymphatic fluids which we call chyle, which has a milky appearance. Okay, then this is how the lymphatic vessels look like. They have a valve which is open, and they have overlapping endothelial cells. And of course, this is just the direction of the lymph nodes of the flow of the lymph. Then this valve, of course, is closed to prevent backflow. Then fluid entering the lymphatic capillary network. Okay, then this is what we are talking about. So, of course, the lymph from the capillaries, and of the lymphatic capillaries, then which collects the lymphatic which takes the lymphatic nodes. And then again, you have the efferent lymphatic vessel. Then this is the afferent lymphatic vessel, which takes to the thoracic duct. So some of the things we actually need to. Then let's continue with the lymphatic capillaries. So these actually originate as blind end tubes in the interstitial spaces. Nearly all tissues have a network of lymphatic vessels, except in the central nervous system, and the cornea of the eye, the bones, and the most superficial layers of the skin actually, of course, don't have them. Okay. Then these are the lymphatic vessels we are talking about. Okay, this is the lymphatic node. Then the lymphatic vessels are all over like this. Okay. Then larger lymph nodes, larger lymph vessels. Then the lymph vessels are found running alongside the arteries and veins, saving the area, and they have a fibrous covering a middle layer of smooth muscle and elastic tissue, and an inner lining of endothelium. Then the lymph vessels have numerous cup-shaped valves to ensure that lymph flows in one-way system towards the thoracic. Then we have the lymphatic pump, where the muscle layer in the walls of the large lymph vessels has an ability to contract rhythmically. Okay. Then the lymph vessels become larger as they join together, forming two large ducts. One duct would be the thoracic duct, and the other one would be the right lymphatic duct, which empties the lymph into the subclavian veins. So this is a lymph vessel which is cut open to show the valves. Then again, this is the structure we're talking about, where we have the lymphatic or the lymph capillaries in the tissue spaces. So let's go to the ducts. Number one duct, which is formed by lymphatic vessels, the two large lymphatic vessels. So number one is the thoracic duct. So this actually begins as the cisterna cali, which is a dilated lymph channel situated in front of the first two lumbar vertebrae. It's about 40 centimeters long, opens into the left subclavian vein in the root of the neck. Then it drains lymph from both legs, then the pelvic and the abdominal cavities. Then the left half of the thoracic, head, neck, and the left arm as well. That's the thoracic. Okay, so this is the thoracic duct we are talking about. This here is the thoracic duct, and it will move like this, and it originates from the cisterna cala in the lumbar vertebrae. Okay, and let's go to the next duct, which is the right lymphatic duct, which is dilated. This is where we have the dilated lymph vessels of about 1 centimeters long and lies in the root of the neck and opens into the right subclavian vein. It also drains lymph from the right half of the thoracic, head and neck, and the right arm. This is the thoracic duct. Then we have the right subclavian vein here, and we have the right lymphatic duct here. So this is the right lymphatic duct, which is here. So let's look at some lymphatic organs and tissues. So number one, lymph nodes. Okay, these are oval bean-shaped organs that lie often in groups. Then the lymph drains usually 8 to 10 before returning to the venous circulation. Then these nodes are as small as a pinhead, and some are the largest, about the size of an almond. Then if they were to tell you to draw, so in anatomy usually they tell you to draw the structure of a lymph node. So this is actually the one we are supposed to draw. Okay, that's the one we are supposed to draw. So we have the afferent lymph vessels here, and the efferent lymph vessels at the item of the nodes. Okay, then you have the capsule, you have the trabecula, you have the reticular tissue, you have the lymphatic tissue here. Okay, then these are also afferent vessels. I think this is one of the easiest structures we can actually draw in anatomy. Okay, just draw. Just start with your afferent arteries, the three afferent arteries. Then we have the efferent arteries this side. Then we have the lymphatic tissue. We're also going to have the capsule. We're going to have the trabecular reticular tissue as well. Okay, so I think you can actually pause and go through more, but I think let's move. Okay, so you can actually pause where you're not clear, try to go back. Okay, the structure of the lymph nodes. So the lymph nodes have an outer capsule of fibrous tissue that dips down into the node substance, forming partition of the trabeculae. Okay, then the main substance of the node consists of reticular and lymphatic tissue containing many lymphocytes and macrophages. Then each node has a concave surface called the hilum, where an artery enters and a vein and the efferent vessels actually leaves. Okay. Then the lymph from the head and neck passes through the deep and superficial cervical nodes, and the lymph from the upper limbs pass through the nodes situated in the elbow region, then through the deep and superficial axillary nodes. Then the lymph from, of course, organs and tissues in the thoracic cavity drains through the groups of nodes situated close to the mediastinum. Then you have large airways, esophagus, and the chest wall. Okay. Then most of the lymph from the breast passes through the axillary nodes. Okay, that's what about the structure of the lymph. Okay, then the lymph from the pelvic and the abdominal cavity passes through the main lymph nodes before entering the cisterna carli. Then the lymph from the lower limbs drains through the deep and superficial nodes, including behind the knee and the groin. This one are known as the inguinal nodes. Okay, so this is what we are talking about. So from the face and the neck, we have occipital nodes, we have submandibular nodes, we have the deep cervical nodes, and you have the superficial cervical nodes. Okay, so these are the nodes. Then in terms of functions of those same lymph, okay, and the lymphatic tissue, okay. So number one function would be to filter and do phagocytosis. So filtering and phagocytosis. So lymph is filtered by the reticular and the lymphatic tissue, which participate in the arterial, which participate, uh, which particulates includes particularly. So this was supposed to be particularly. Okay, so the same phagocytosis particularly include bacteria, dead and live phagocytes. That's what the phagocytosis we're talking about. Okay, so the live phagocytes containing ingested microbes and cells from malignant tumors, worn out and damaged tissue cells, and inhaled particles are actually phagocytosed. Okay, and of course, filtered. Then organic material is destroyed in the lymph nodes by macrophage and the antibodies. Then some inorganic inhaled particles cannot be destroyed by phagocytosis. Then these inorganic materials remain inside the macrophage, either causing no damage or killing the cell. So materials not filtered out and dealt with, one lymph node passes into or onto the successive nodes, and by the time the lymph enters the blood, it is usually been cleared of foreign matter and cell debris. Then in some cases where the phagocytosis of the bacteria is incomplete, they may stimulate inflammation and enlargement of the node, which we call in term which is termed as lymphadenopathy. Okay, so lymphadenopathy is the enlargement of the nodes. Okay. Then number two function is proliferation of lymphocytes. So activated T and B lymphocytes multiply in lymph nodes. Then antibodies produced by synthesized B lymphocytes enter the lymph and blood, draining the node. So this is one of the other functions to proliferate the lymphocytes. Okay, so this is just a color scanning of micrography of lymph nodes tissue, and there's a cell population which includes the reticular cells, which are shown in brown. Okay, these ones are the reticular cells. Then you have the macrophages which are shown in pink. Then you have the lymphocytes which are yellow. Okay, then let's go to one of the lymphatic organs, which is of course the spleen. Okay, so the spleen contains reticular and lymphatic tissue and is the largest lymph organ. The position of the same spleen is found in the left hypochondriac region of the abdominal cavity between the fundus of the stomach and the diaphragm. Okay, it is purplish in color and varies in size. It is 12 cm long, 7 cm wide, 2.5 cm thick, and it weighs about 200 grams. So that's about the spleen. Okay, so this is the spleen we're talking about, which has the gastric compression, of the renal impression, gastric impression, the renal impression, and these are the splenic artery and the splenic nerve, and position of the tail of the pancreas. That is where it's actually positioned. And the colic impression is this one. This is the structure of the. Okay, so other organs associated with the spleen, superior and posteriorly, we can have the diaphragm. Then inferiorly of the left colic flexure of the large intestines. Anteriorly, we have fundus of the stomach. Then medially, we have the pancreas and the left kidney. Laterally, we have laterally is separated from the 9th and 10th and the 11th rib and the intercostal muscles by the diaphragm. Okay, then in terms of structure, so it is slightly oval in shape with the hilum of the lower medial border and its anterior surface is covered with the peritoneum. It is enclosed in a fibroelastic capsule that dips into the organ, forming the trabeculae. Then the cellular material consisting of lymphocytes and macrophages is called the splenic pulp and lies between the trabeculae. Then we have the red pulp, which is the parts suffused with the blood, and the white pulp, which consists of areas of lymphatic tissue where there are strips of lymphocytes and macrophages around the blood vessels. This is about the structure of the. Okay, so this is where the spleen is. Okay, of the vein artery, then about the white pulp and the red pulp and the capsule, of course. Then these structures entering and leaving the spleen at the hilum are, we have the splenic artery, which is the branch of the coeliac artery. Then we have the splenic vein, which is a branch of the portal vein. Then we have the lymph vessels, of course, where we have the efferent only. Then we can also have veins. Then, of course, blood passes through the lymph, through the spleen, flows in sinusoids, which are distant pores between the endothelial cells, in close association with the splenic pulp. Then this is essential for spleen's function in removing aging or damaged cells from the bloodstream, for instance, red blood cells. Okay. Then this is the structure we're talking about, the splenic pulp, the trabeculae, and the capsule. Then you have the splenic artery and the splenic vein, and this is a lymph vessel here. Okay, then you cut through the section through the then functions of the spleen. Number one is phagocytosis, whereas for odd and abnormal erythrocytes, red blood cells, are mainly destroyed in the spleen, and the breakdown products, bilirubin and iron, are transported to the liver via the splenic and the portal veins. Other cellular materials, for instance, leukocytes, platelets, and bacteria, are also phagocyzed in the spleen. Then apart from that, it's also used for storage of blood. Okay, so the spleen contains up to 350 ml of blood, and in response to sympathetic stimulation can rapidly return most of this volume to the circulation. For instance, when someone is having hemorrhage, so you can actually return this blood back to the circulation. Then the other function, we have number one, which is immune response. So the spleen contains T and B lymphocytes, which are activated by the presence of antigens, for instance in infection. The lymphocytes proliferation during serious infection can cause enlargement of the spleen, which we term as splenomegaly. Then the other function is erythropoiesis. So the spleen and liver are important sites of fetal cell production. So fetal, the point here is fetal cell production, and the spleen can also fulfill this function in adults and in times of great need. So it's one of the sites of the erythropoiesis. Okay, so production of course of red blood. So we are done with the spleen, which is one of the organs of spleen of lymphatic organs. The other lymphatic organ we can talk about the thymus gland. Then of course the thymus gland, the position is found in the upper part of the mediastinum, behind the sternum, and extends upward into the root of the neck. Then the weight of the thymus is 10 to 15 grams at birth and grows until puberty, when it begins to atrophy. Its maximum weight at puberty is between 30 to 40 grams, and at middle age it has returned to approximately its weight at birth, whereas it returns to somewhere 10 to 15 grams at birth, and even when you age, of course. Then this is the structure of the thymus. Okay, that's the structure of the thymus. Right lobe, left lobe, the lymph duct, lymph vein, and the lymph vein and the arteries which are passing through here. Okay, so that's the structure of the thymus. Okay, then the thymus gland in adult and related structures. Okay, so this is the right lobe of the thymus, and this is of course will be the left lobe of the thymus. Then superior, you find that there will be the thyroid gland on top. Okay, that's the thymus we're talking about. And so I always used to confuse thymus and the thyroid, since they have since they are located within the same thoracic cavity. Okay, but this is how in anatomy they differ. So the thyroid is superior, whilst the thymus is inferior to the thyroid. Okay, then organs associated with the thymus. So anteriorly, we have the sternum and the upper four costal cartilages. Posteriorly, we have the aortic arc and its branches, of the brachiocephalic veins and the trachea. Laterally, we have the lungs. Medially, we have the structures in the root of the neck. Then inferiorly, we have the heart. These are structures associated with the thymus. Okay, then structure of the thymus. You know that the thymus consists of two lobes, like we discussed, and the two lobes are joined by areolar tissue. Then the lobes are enclosed by a fibrous capsule which dips into their substance, then dividing them into lobules that consist of an irregularly branching framework of the epithelial cells and the lympho. Function of the thymus. The thymus, of course, have lymphocytes which originates from stem cells in the red bone marrow. Then those that enter the thymus develop into activated T lymphocytes. Then thymic processing produces mature T lymphocytes that can distinguish self-tissue from foreign tissue, and it also provides each T lymphocyte with the ability to react to only one specific antigen from the millions it encounter. Okay, that's one of the functions. Okay, then the T lymphocytes also then leaves the thymus and enter the blood. Then some enter the lymphoid tissues and others circulate in the blood stream. Then the maturation of the thymus and the other lymphoid tissue is stimulated by the hormone thymosin, okay, which is the hormone secreted by the epithelial cells of the thymus gland. Okay, so usually I like to ask in matching question. I usually like to ask on column A I put thymosin, and column B there is thymus. Of course, this is one of the easiest matching questions. So thymosin produced by secreted by thymus gland. Okay. Then the mucosa associated with the lymphoid tissue, which is of course the moat, as they call it. So mucosa associated with lymphatic tissue, moat for short. So moat is found throughout the gastrointestinal tract, then in the respiratory tract, and in the genitourinary tract as well. Then the main groups of moat are the tonsils and the aggravated lymphoid follicles, which are the Peyer's patch. And tonsils are located in the mouth, throat, and therefore destroy swallowed and inhaled antigens. Then aggravated lymphoid follicles, which are the Peyer's patch, these large collections of lymphoid tissue are found in the small intestines. That's about mouth. Okay. Then in the intestines, we talked about the Peyer's patch, which are roughly egg-shaped lymphatic tissue nodes that are similar to lymph nodes in structure, except that they are non-surrounded by connective tissue capsule. They belong to a class of non-encapsulated lymphatic tissue known as lymphatic nodules, which of course includes tonsils and the lymphatic tissue of the appendix. Okay, hope you have gotten something. Then lymphatic diseases, someone can have lymphangitis, okay, someone can have lymphatic obstruction or lymphedema, but there's no space, of course, this lymphedema. Okay, then the other condition is lymphadenitis, and have lymphomas such as Hodgkin's and Hodgkin's lymphoma. Then disorders of spleen can have splenomegaly. Okay, those are some of the disorders of spleen. Okay, then checkpoint. So of course you don't need to go through our checkpoint. So checkpoint, the question is the lymphatic system consists of. So it's not, the question is asking what consists the lymphatic system. The other question is list the function of the lymphatic system. Then the other question, what is the shape of the lymph node? And you can actually be asked to draw the lymph node. Okay, then lymph from head and neck drains in dash nodules. Okay, write the functions of the lymphatic organs and the tissues. Which is the largest lymph organ? What is the weight of the spleen? What is the shape of the spleen? This is the function of spleen. Write the position of the thymus gland. Then the maturation of the thymus is estimated by which hormone? Okay, write the full form of mouth. Okay, those are some of the checkpoint things you need to actually go back, especially if you are failing to answer these questions. Okay, so we've come to the end of our tutorial. Thank you for watching. If you haven't subscribed, please subscribe and hit the bell notification, and of course share this video to people it will benefit. Okay, thank you. See you in the next tutorial.